Millions of people suffer from psychiatric disorders like depression, anxiety, PTSD, OCD, eating disorders. And getting help is critical, and our next guest uses new treatments and even therapy dogs, Melvin and Sophie, to help patients cope. Child and family psychiatry nurse practitioner Jeff Edelman, owner of Foundations for Change, is back with us, along with his patients, Jared and Ashley Hartman. Thank you all for being here. First, Jeff, what is Foundations for Change?
It's a psychiatric practice that treats children, families, and first responders and military, where we provide all level of services, medication management, we refer to therapy and testing. We try to take care of the whole family and move them forward in a healthy way. And
one of those treatments is ketamine therapy. How is this administered and what conditions does it help?
Ketamine is an old anesthetic we discovered is good for stopping or halting depression, anxiety, PTSD, OCD, chronic suicidal thoughts. It's done over a series of 6 IV infusions in 2 weeks, and short of somebody being miraculously healed, I have not found anything in psychiatry that has such a profound effect on people in helping them to move forward and to be well, be safe, and to be able to do rapid and aggressive other treatments.
And Jared, you are a Phoenix firefighter, and you are receiving ketamine therapy. What were you dealing with?
A couple of years ago, I responded to a car accident involving a family member of mine. Ever since then, I knew I was having some of the symptoms of PTSD. I just never really had the courage to ask for the help. But I kind of reached a point to where I couldn't do it on my own anymore, so I asked my fire department for help, and they referred me to Jeff.
Right, and you ended up having PTSD and OCD you were suffering with, so you received the ketamine treatment. Describe that treatment for us, and how are you feeling today?
It was a treatment of 3 times a week for 2 weeks. And it was basically the first time in a couple of months where I was able to just shut my brain off from all of the obsessions and all of the thoughts I was having because of the PTSD.
Right.
After the first session of ketamine, I felt a drastic improvement right away.
And you had how many treatments?
I did 6 total.
Okay. And Ashley, you also receiving treatment. Why did you decide to get treatment as well?
So Jeff had noticed in the beginning, every time I'd go to Jared's therapy sessions with him, that I probably needed some support as well. One of his big things is that to make sure the whole family's okay. I was working, taking care of the kids, and it was important to make sure that that support system at home was stable and strong, so that way all of us could head in the right direction.
Right, so you're all moving at the same pace. And your 2 St. Bernards who are with us, Melvin and Sophie, they're a big part of the treatment as well. They're in the practice with you every day, Jeff.
Yes.
How do they help patients?
Well, obviously a lot of people do not like needles and do not like to have IV started, so they are present much of the time when people are starting treatments, and a lot of times throughout the treatment to help them relax, and they act as a distraction. They're pretty intuitive, and they annoy people and stuff.
And they keep their mind off of it. What is the success rate of ketamine therapy?
It's 72 to 75% of people respond very well to ketamine infusions, and I have seen even better than that in my practice so far.
And you're going to come back and talk about your community partners in your next segment.
Yes, I am.
Well, thank you all so much for being with us. And it's the bravest thing you've done, I'm sure, is getting the help that you need. And we wish you all continued success.
Thank you.
Let's give you some information. Foundations for Change, they offer adolescent and adult psychiatric services at 2 Valley locations, Peoria and Phoenix. To book an appointment, call 602-399-5792 or visit foundationsforchangeaz.com.